Hi again, everyone. I'm Candace Kruger along with Jim Knox. We're back again with another edition of the Best Docs Network featuring Forest Park Medical Center, your destination to better health. And of course, Jim, one of the top medical centers in all of the Dallas Frisco area.
Top medical center like Forest Park Medical Center also has some of the best doctors, like our first doctor, Dr. Bradley Friedman.
Just noticing things changing as I got over 50 years old. You know, being a little more tired, and that just wasn't me. I started just seeing TV commercials with low T and was kind of like, well, what's low T? And then they start talking about the symptoms. So, you know, I went to see Dr. Friedman, and we did a blood test just to run the test, and my testosterone level was definitely low.
Low testosterone is a condition in which men produce less testosterone than adequate to maintain their vitality. In that respect, it's energy, libido. Low testosterone can cause depression. It can cause trouble sleeping. It can cause high cholesterol. It's generally a slowdown of the body if a man has a low testosterone.
He said, well, we'll prescribe the androgel, try this and you should see a difference within probably 2 to 3 weeks. But within 2 weeks, I could see a difference.
When Mr. Townsend came in, he was complaining of many of these same factors: decreased energy, lack of excitement with normal things that made him happy previously, and he asked me to check his testosterone during a physical. When we checked it, we found that it was low and he was deficient in testosterone. So we decided at that point that he couldn't improve it all that much, so we would go ahead and put him on treatment. He went on treatment and felt great.
My energy level, my exercise routine, my mental state just seemed like it was a little better, and you know, just like not where I would have those kind of, at the end of the day, just feel tired and feel kind of like just not wanting to do anything and just kind of sit for a little bit or something. Now I felt like, you know, I just had more energy. You know, I maybe felt like I was back in late 30s or 40 years old instead of being 53 years old.
Within a month later, his testosterone unfortunately was too high, but he felt wonderful and he felt great. But he decided that he didn't want to go on the medication at that point. He wanted to try the diet, the exercise, and try and modify his lifestyle in order to boost his testosterone. He did those things, and he did great.
Dr. Friedman, I think, is great. He's always seems like he's very caring and listening to what, you know, issues would be, and if there was anything else going on, he'd ask me about background. Him and his staff are all very professional.
We're here at Forest Park Medical Center of Dallas, where we are a bariatric center of excellence through the American Society of Metabolic and Bariatric Surgery. What a bariatric center of excellence is it's a designation that a facility has to actually apply for. It covers 10 very vigorous standards that are set forth from the American Society for Metabolic and Bariatric Surgery, and they actually come and interview, they audit charts, they look at outcomes, and they look at 10 very vigorous standards to make sure you meet those standards, from the equipment you have to care for your patients, the personnel that you have involved taking care of the patients. And it's there for patients to be able to select a facility that is above and beyond for their care of bariatric patients.
Part of being a bariatric center of excellence means that we're able to handle any complications that occur with our patients. So we have several physicians that we can consult for whatever needs we may have, whether that be pulmonology, nephrology, neurology, any of those things that we may need. We have those here at our fingertips, and we have that for the ICU and the ER as well.
I oversee all of the medical nutrition therapy both before and after surgery with the bariatric patients. So up to 6 months prior to bariatric surgery, patients can come and see us and work on lifestyle changes. And then we also visit with the patients here in the hospital immediately after surgery, and we offer post-op classes just to kind of keep everybody on track up to a year following the procedure.
I help teach the pre-op in the seminar classes for our bariatric patients or our prospective bariatric patients. We do inpatient teaching after they've had surgery, as well as do the lap band adjustments once they've had surgery. We do upper GIs. We do see them from prospective patients, and post-op wise, we see them throughout the whole course of their procedure, as well as 2 years out, 3 years out. So we continue to follow up with them and see how they're doing and continue their education.
The pre-op procedures that we do in radiology are the upper GIs, and they like to do that to be able to see the intestinal tract before they have surgery, so the doctor knows what they're working with. And then post-op, we bring the patients down and we do upper GI so that the doctor can make sure that all the suture lines look good and there's no leaks and everybody's good to go home.
We do around 3% of the cases nationally for bariatric surgeries. That means that out of all the thousands of bariatric surgeries nationwide, this specific hospital does 3% of them.
We have a great multidisciplinary team, and we do have a great team of our dietitians, our nurses, our surgical staff, our respiratory therapists, physical therapists, radiology techs, everyone. And it takes every one of those members of the team to provide great patient care. And without any one member of the team, we couldn't be as effective as we are.
I just decided that in my 30s I was not going to be fat and I needed a little help. Literally, it took me 3 years to get up to that moment. I've been putting it out because I work in a hospital. I don't want to be a patient there.
Bypass is restrictive and malabsorptive. It's restrictive in that we make the stomach small. We make a small pouch from their stomach. The remaining portion of their stomach stays in their abdomen. Don't change the blood supply, don't change the nerve supply, so it doesn't shrivel up and it doesn't die, it doesn't go away. And we then reroute their small bowel, and that's the malabsorptive part.
Which is a little bit better than, for me, long-term weight goals. Slow process in the beginning, but overall it'll all come down.
I think the bypass probably is going to offer the most weight loss and the most sustained weight loss. And in particular, it's the only bariatric procedure right now that we have long-term studies that show it'll help resolve hypertension, diabetes, symptoms of reflux disease, as well as a myriad of other health problems that people get whenever they are overweight and obese.
At the end of the day, she will have you to where you are aware of what you're getting ready to do, you understand the procedure, and you feel safe. With my surgery, she said, today is the big day. Are you ready? I am. Let's do it.
When I saw her 1 week after surgery, she was already down 16 to 18 pounds. We'll see her again for her 1 month follow-up, and I think that she'll probably be down another 15 to 20 pounds. She's having a really good outcome.
When I seen her for my follow-up visit, I couldn't do nothing but say, Dr. Hodges, give me a hug. And I gave her a high five. So she asked me how I was feeling. I told her how I was feeling. No problem. She told me to take it easy, and she was proud of me.
At Forest Park Medical Center, we do a significant number of weight loss surgeries. And I think it's a little bit disingenuous for us to provide surgical services that help people lose a lot of weight without having an organized way to help them get rid of what's left over after the weight loss.
The Post-Bariatric Surgery Center, the program started at Forest Park Medical Center because there is a need for this situation, this kind of surgery.
We felt that there were a lot of patients that had put a lot of effort in to undergo bariatric surgery and transform their lives, but they still were burdened by some of the problems that patients have after these surgeries before they undergo body contouring, such as excess skin, rashes, and other problems. We really feel like the full transformation is possible for these patients after they undergo body contouring.
Not only do you have problems with body image when you're very, very heavy, you can have problems with body image after you've lost all the weight and now your body doesn't look anything like you thought it was going to look because you've got stretched out skin that doesn't bounce back. You still have some thick areas that you can't lose, and it all is in places that you don't want. Because some patients ultimately, their diabetes gets better, their hypertension gets better, their overall health gets better, but their body image just shifts to another unhappiness. And that's what we're there to do, to try and provide that happiness for them.
The benefit of having two surgeons, and not just assistants, the trained surgeons, is that we work with one leading surgeon. The most experienced surgeon leads the surgery, and the second surgeon just follows through.
What that does is that it allows us to accomplish the same procedure in a staged fashion, but also in a more timely fashion.
There's no surgeon that can be as sharp at the end of that long, tiring operation, because this is physically demanding work. And so we know that if we extend it too long, patients aren't going to get the best result. So we get well-trained, properly trained surgeons working together to limit the operating time and improve the effectiveness and ultimately the results for our patients. At Forest Park Medical Center, we have the dietary issues, the nutrition part, we have the surgical weight loss, we have the post-bariatric weight loss body contouring component to get them to their final endpoint. So the continuum of care from beginning to end is all in one place. And Forest Park Medical Center in Dallas has the ability to do that, unlike any place else in the country.
Forest Park Medical Center Dallas Frisco is your destination to better health. And all of the doctors that operate right here are dedicated to changing people's lives. Like our next best doctor, it's orthopedic surgeon, Dr. Dan Aldrich.
Quality of life before a replacement is miserable. The shoulders hurt, you can't sleep. The pain is sharp, dull, burning, and it's always there.
Joint replacement is a very common procedure now in our country, but the most common are knee and hips. A lot of people aren't even aware that shoulder replacement exists, but it is a really great option for people with severely arthritic shoulders. We've come a long way in the last 10 to 20 years with the materials we use. The techniques have been really refined so that people can get a very good result with a shoulder replacement where they can have pretty much full use of the arm again without pain.
We did the right shoulder replacement in 2010, and since I loved the way my right shoulder was doing and the left shoulder was still giving me a lot of fits, I thought, okay, maybe it's bad enough I can get a replacement on the left one. So in January the 15th, I had the left shoulder replacement.
Belinda was a typical case where she was someone who had gradual deterioration in her shoulder, and she had both shoulders involved with severe arthritis. And she had tried the usual treatments, Advils and Aleve and cortisone injection and physical therapy until the point where she just really was having severe pain all the time. And that was the point where we had to talk about replacement. And we did shoulder replacement on both shoulders, and she's done extremely well and has had a great result and is pain-free and has true unrestricted use of both shoulders at this point.
The new shoulder replacement, Belinda, is a very happy person. Dr. Aldrich is a very good doctor. He's knowledgeable in all he does. The quality of my life is improved by what he's done.
Chris has a question for Dr. Troy Diehl. What is the difference between a sprain and a fracture?
A fracture is actually a broken bone, whereas a sprain is an actual tear of the ligament that attaches or stabilizes two bones. So a sprain, in the sense, is more soft tissue related, whereas a fracture is related to the bone. And a sprain itself can be different grades. You can partially tear a ligament or you completely tear a ligament. In all, that all encompasses what a sprain is. A sprain essentially is a tearing of the ligament that supports our joints.
For more information on Forest Park Medical Center, head to the website bestdocsnetwork.com and click on that Forest Park Medical Center tab. Forest Park Medical Center, your destination to better health. And of course, Forest Park Medical Center, Candace, the folks need to know they brought together the best of the best, from staff to surgeons to technology and technique. And now it's time for our next best doctor operating right here out of Forest Park Medical Center.
He certainly does. He's neurosurgeon Dr. Jeffrey Cattorini, who helped one patient suffering with a tumor on her spinal cord.
I started having tingling in my legs and toes, and it progressed. I knew there was something very wrong. So I made an appointment with my family doctor. Said that he thought that I would most likely have to go to a neurologist. After going through a number of tests, I had a cervical MRI on July the 3rd, and they found a very large tumor in my spinal canal.
Spinal cord tumors, when they present, generally present with weakness or numbness, but the weakness and numbness will not go away with conservative measures in terms of medication, cortisone injections. It will continue to progress. Spinal cord symptoms typically go on the order of months instead of days to weeks. They tend to get worse as time goes on, and they do not get better with conservative treatment.
When I went to Dr. Cattorini, he brought up my MRI and also had a skeletal prop that he showed me exactly where the tumor was and how large it was. He also explained to me that because it was so large, there were certain parts in the canal that were going to, be very close, where he may have to radiate the tumor. He went through everything, what the surgery was going to be like, how long it would take approximately, recovery time.
Surgery for spinal cord tumors is considered microsurgery. The tumor is removed under 1,000 times magnification underneath an operating microscope. Small instruments the size of toothpicks are used to remove the tumor and the size of the head of a pin. And so it's a very delicate procedure and one that requires skill and patience.
I'm 4 weeks out of the hospital, and it's been an amazing recovery. Dr. Cattorini, removing this tumor from my spinal canal has given me back my quality of life. I just cannot thank him enough for what he has done for me. I feel the best I have felt in a very long time, and that is because of his skill and the surgery.
I had a lot of, I guess you'd say, illnesses where I was diabetic, I had neuropathy, had a lot of health conditions that motivated me to lose weight, and so that's why I had the bariatric surgery. 9 months later, I lost 120 pounds pretty fast. Losing so much weight so fast, I lost a lot of tissue, and so skin was an issue. My elasticity wasn't going to be very good in my skin, so that really bothered me.
Imagine you weigh 350 pounds, what it takes to change your life, to really get over the inertia, have an operation where there are significant risks, and then you drop 150 pounds, 180 pounds. And that's what Summer did.
At the consultation with them, I didn't really know what to expect. I walked in here hoping, that I'd come out looking like a supermodel. But they were very adamant on letting you know that they were going to do things that made you look more natural, and I like that because I don't want to look fake.
Summer went from, a very unhealthy type of individual to someone who's really motivated to change her life. And we were kind of the end part of that whole process, and we got to benefit from the sheer happiness that she had once we were finished with all of her body contouring. And it's just great to see. I mean, when you look at her and talk to her, she's a totally new person, and she loves who she is, and she's happy who she is, and she's really happy that now she can wear the clothes that she wants. She doesn't have to tuck anything in and hide anything. She doesn't have any rash issues or anything like that, and her body's tight and toned and really makes her happy. And so that's why we do it.
Now I have confidence to be able to do the things I couldn't do before, and so I'm not embarrassed to run around with my kids, and I can be a better mom because I have confidence. Dr. Barcella and Dr. Genecov are more than surgeons. I think they're artists. I feel good in general about life. Coming to the Body Contouring Center at Forest Park has definitely changed my life. It's been good.
When it comes to developing gynecologic cancer, Dr. Jonathan O has a few reasons how it develops.
For most gynecologic cancers, they're what we term sporadic, meaning that there's no familial disposition, there's no genetic link. So about 85% will just be sporadic, but a small percentage will be hereditary.
When dealing with gynecologic cancer, there are signs and symptoms to watch for that are associated with the three most common cancers. First, ovarian cancer.
For ovarian cancer, the signs and symptoms are very generalized. And when I say generalized, what I mean is that the symptoms are not specific to what you would think would be gynecologic cancer. So the most common complaint that women will have for ovarian cancer is bloating and distension. So it's not pain, it's not any problems with what they feel like is their female organs, but it's just feeling bloated. Oftentimes people come in saying that they just can't eat as much, they feel full really early, they feel like their bellies are getting bloated and their clothes are fitting more tightly. And these are problems that just persist and progress over time.
Another form of gynecologic cancer is uterine cancer, which is common among both older and younger women.
The most common sign for uterine cancer is postmenopausal bleeding. So if a woman generally over 50 who's done having periods starts to have any bleeding, then she should seek medical attention because that's a very, very worrisome sign, and that's the most common sign for uterine cancer. The most common sign for uterine cancer in a young patient would be heavy vaginal bleeding. So if you have bleeding that's much heavier than your typical period and this persists over several weeks to several months, then that warrants an evaluation and biopsy.
Now to the third common gynecologic cancer, which is cervical cancer.
The most common symptom for cervical cancer is abnormal bleeding. And oftentimes this will present as what we call postcoital spotting. And postcoital spotting is just a fancy term for spotting or abnormal bleeding after intercourse. What will happen is that the cancer will develop on the cervix with what we call trauma, and trauma could be intercourse. It stirs the cancer up and causes it to bleed, and women will present complaining of bleeding.
If you are having any of these signs and symptoms, please consult your physician.
Danny came in to see me as a somewhat typical, active, professional male who, as I see in a lot of males, just kind of ignore problems for a while.
The last 2 or 3 years, it's just my quality of life just went downhill. I hadn't been able to stand up and walk. I started experiencing pains in the right hip, and I just kept putting it off. Well, you know, it'll go away, and then it got so bad I couldn't hardly walk.
After a short physical exam and just seeing him walk, we obtained an X-ray. And it was very obvious that he didn't just have moderate osteoarthritis of his hip, he had advanced disease that he'd been living with for years and years and probably more than a decade.
I was very impressed with the way he presented himself, very professional. He talked extensively about what precipitated it, why it is, and how we're going to get there to make this work. You could tell that Dr. Saadi was very interested and he really liked what he did. It was just not an 8 to 5 go home. The more he talked about it, the more he got jazzed up about it, you know. And then we went into the navigation and the robot stuff, and he went in talking about the technology on that. So I instantly could tell that Dr. Saadi was my guy. This is the guy I like. He's precise. He's very clairvoyant on where he's going and how we're going to get there and what we're going to do. Went ahead and performed the hip surgery. I was up and walking the next day, you know, going with this, you know, with the walker and various things, and it was a matter of just 4, 5, 6 weeks, I guess. I was actually walking totally unassisted without any pain whatsoever. It was just, I couldn't be more happier with my hip.
I think Danny's doing great. I think that he recovered as fast as anyone that I've seen. Within 7 days of surgery, he was doing the same or more than he'd been doing in terms of activity with less pain from the day before surgery.
I'm very happy. I'm very pleased with the results. Forest Park was awesome. The nurses over there were super. I wanted it clean. I didn't want any issues after. I didn't want him to have to go back. I wanted to go 1, 2, 3, 4, let's get it done and get out of there, and that's exactly what it was.
For more information on beautiful Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Forest Park Medical Center is your destination to better health. Right now, it's time to head to our next best doctor who operates out of Forest Park Medical Center. It's plastic surgeon, Dr. Jeff Angobaldo.
I had back pain, I had neck and shoulder pain, and my breasts were large, and it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain, and it would help for a while. And then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she was been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angobaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her axillary tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her, and she felt it immediately.
I'm looking forward to the fashion options that I'll have now, and just looking proportioned, no more pain. I'm just really excited.
Angie has a question for Dr. Richard Salter. What is the recovery time after a hysterectomy?
About 30% of my patients will go home the same night. The remaining patients usually go home the following morning. The majority of them are driving within a week, and the majority of them are back at work within 2 weeks. Full activities probably within 4 weeks.
That'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center is your destination to better health, and it's one of the top medical centers in all of the Dallas Frisco area.
For more information about Forest Park Medical Center and their fine physicians that operate out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on that Forest Park Medical Center tab.
And if you have a question or comment, we'd sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.